Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Root Causes Clinic, who matches patients with an holistic wellness provider specialising in functional medicine to help them find and treat the root causes of their symptoms. Available in 35 states in the US and is 100% online. For your free 15-minute consultations with one of their practitioners today, visit rootcausesclinic.com. Today I'd like to welcome my guest, Dr. Sajad Zalzala, who likes to be called Dr. Z, and I can understand why. Thank you for joining us today.
Thank you for having me.
So could you tell us about yourself, where you're from, what experience you've got, etc.?
Yeah, so my parents came to this country as students, but they in the mid '70s, and they stayed. And they settled in Michigan, where I grew up. I attended Wayne State University for my undergraduate and medical school studies. I actually started out as a computer science major. When I graduated high school, I really didn't want anything to do with medicine and people who were ill. But about 3 years into my undergraduate degree, I was working at the time as well in the computer field. I realized I was gravitating more towards the customer service aspect rather than the computer technical aspect, and I can't really explain why, but I was drawn towards the medical field. It was I can only describe it as a vision or an epiphany or something like that kind of told me that I was wasting my time with computers. And so I switched gears and I got another degree in biology and applied for medical school, and I was accepted. But about a year into my medical school, I struggled with a couple of the courses. Medical school is just a lot harder than any other class or education I'd ever had, and I almost thought about dropping out until I learned about integrative medicine. And when I learned about integrative medicine, it kind of opened a whole new door to me. And I spent the rest of my I've spent the rest of my free time, or a lot of free time since, learning about integrative medicine, going to conferences, reading books. Learning from other doctors who are doing it.
Mm-hmm. So are you an ND, a naturopathic doctor?
No, I am a medical doctor, MD.
Yeah.
And I actually, when I thought about leaving medical school and I learned about integrative medicine, I thought about going the naturopathic route, but I decided I would do better in my career if I stayed as a medical doctor.
Mm-hmm. Being nosy here, are your parents in the medical field?
Well, my father had a degree in engineering, so no. My mother did some coursework in nutrition, so she was a nutritionist for a while. At least her degree was. She never really got much of a chance to work in the field, raising kids and all. There were four of us.
She had a hands full then.
Mm-hmm.
So when you qualified, what did you do?
Qualified for?
Being a doctor.
Oh, what do you mean, like celebrate or?
No. I was just trying to establish what training, what work you had done since being trained.
Oh yes. So here in the States, after medical school, you have to apply for a residency program, and that determines the field of study or the field of medicine that you practice.
Mm-hmm.
And you could choose to, be a subspecialist like cardiology or radiology, or you can choose to be continue as a on a general track as like a general practitioner. I gravitated towards family medicine because I felt that would be the training that would be most in line or beneficial with the idea of the holistic or integrated medicine approach. There is no residency program that deals with integrated medicine. They're all, ACGME certified by, accredited by the government and other various agencies to have very similar curriculum, and very little, if any, of the curriculum has to do with integrated medicine. So all of that I learned on my own. After residency program, after I finished my residency, I wanted to do my own thing, to start my own practice. However, it would have been very difficult to start a practice right out of residency because you need to get a loan. You need to have several exam rooms. Several employees. So that's a lot of people ask me why I work in Canada, and I'm not Canadian. I'm actually American, but I found an opportunity to start a general practice clinic in Canada, Windsor. So I've been working for about almost 6 years now as a general practitioner in Ontario.
Mm-hmm. So you were telling me there, family medicine. What age group do your patients fall into?
Well, family medicine, we're trained to see patients from basically cradle to grave.
Mm-hmm.
I routinely see patients from newborn all the way up to, I think the oldest patient I have currently is 103 or something in that
Wow.
age range.
That is quite some age, isn't it?
Mm-hmm.
So, in all that training you did and your experience, where did LDN fit in? Did you have any training at college?
Officially, no. Like I said, the holistic integrative medicine was not part of our official training.
Mm-hmm.
I went out on my own. I sought out other physicians who were practicing integrative medicine, and I did rotations with them when I was a student and a resident. I attended conferences, audiobooks, textbooks on integrative medicine and functional medicine, pretty much anything I can get my hands on to try to learn. And I learned about LDN. I can't remember exactly where it was. I think it was one of the integrative medicine conferences I went to early on in my medical career, probably when I was a resident. I can't remember exactly where it was, but I remember thinking that, this is a very interesting treatment.
Mm-hmm. Okay, so how long would you say it's been since you've first started prescribing LDN?
I think the very first prescription was almost probably the first week of my own practice, about 6 years ago.
Mm-hmm. And what was that condition you treated?
I don't remember off the top of my head, but I do. If I had to bet on it, it would probably be fibromyalgia. Mm-hmm. That is a condition I see a lot of, and a lot of patients struggle finding treatment for that condition. Mm-hmm. And I usually, either patients have read about LDN and they ask me about it, or I propose it to them. And it does take a little bit of work on my part to educate a patient about LDN because it's very confusing.
Mm-hmm. What would you say the youngest age is, patient-wise, who's taken LDN?
In my practice,
mm-hmm.
I don't think I had too many requests for pediatric requisitions or prescriptions for LDN. I think the youngest I've treated so far was probably 12.
Okay. And what about the 103-year-old? Is he on LDN?
No, I don't think so. I don't think so. I think the oldest patient I have on LDN is probably in their 70s, maybe.
Okay.
Now, I mean, not that I couldn't help the 80-year-old. I mean, it's just that when choosing a therapy, when trying to figure out whether LDN is right for a patient, there's a lot of things you have to look at. The patient's ability to afford the medication because it's often out of pocket. Their openness and their willingness, the other medications that they're on. Their ability to comprehend how to use it. A lot of times patients are seeing other physicians, so sometimes you have to take that into account. I've had some interesting calls from fellow physicians who ask me whether their patient is alcoholic and why I prescribed naltrexone, and I had to explain to them that it wasn't naltrexone, for the FDA indication of alcoholism, but it was, the low dose naltrexone for immune and for immune support and the anti-inflammatory effect.
Mm-hmm. So, can you give us a rundown of conditions that you've treated with LDN?
Like I said, the most common condition is fibromyalgia. Other common conditions include pretty much any autoimmune condition you can think of. Most commonly, multiple sclerosis, Crohn's disease, ulcerative colitis, rheumatoid arthritis, lupus. I've had several patients ask me about it for Hashimoto's disease. Hashimoto's thyroiditis, the most common reason for low thyroid. So I'm trying to think. Sjogren's syndrome with the dry mouth. Like I said, pretty much any. I'm sure that there's many other autoimmune conditions, but that's probably the number 2 indication. And then I've had a few patients where I've requested for Lyme disease, or they had testing that indicated that they might have a chronic viral, like Epstein-Barr virus or cytomegalovirus that their body's having a hard time clearing. And then probably a few patients have asked me about it for cancers of different types. Okay.
What about mental health? Have you treated any patients with that?
I can't say I've treated too many patients with mental health for LDN.
Okay.
That's something I haven't read too much about that, so that's something that I probably have to look into. There's certainly a big need. There's certainly been an increase, it seems, of patients being diagnosed with mood disorders.
And also post-traumatic stress disorder as well is a big one that LDN is being used for, as well as different types of depression, etc. But you said you don't yet treat pediatrics. Maybe that will change in the future. I mean, there are doctors that are prescribing it for juvenile arthritis, juvenile Crohn's, asthma, eczema, all the different childhood things there. And psoriasis is a very good condition that seems to respond to LDN. It normally takes a little bit longer to see results with it, but by sticking with it, it does seem to be pretty good. No.
Oh yeah, no doubt. I mean, even for mental health, I guess now, not thinking about the mechanism of action, I guess that would be a good indication. I just, when I learned about LDN, it was mostly about the immune system function, which the autoimmune and fibromyalgia, things like that. But I just haven't had anybody ask me yet about mood. I should definitely think about that.
So, what I would like to discuss now, for all the people out there who have been looking for a doctor who isn't available in their area to do a face-to-face, you do telemed consultations. So could you tell us how that came about and how you do it?
Sure. So I got the idea of doing telemedicine consults probably about 2 years ago. There was a company that I was consulting with that had a really good migraine functional medicine approach to migraines, and it got me thinking. that functional medicine, integrated medicine, you don't always necessarily need to be seen in person for treatment, because a lot of times it's focused on lifestyle, supplements, things like that, dietary changes. So it got me thinking that there must be a lot of patients out there who are outside of the range of being able to see a person, a practitioner in person, to get access to holistic, integrative medicine therapies, and that led me on this licensing binge, so to speak, where I started applying for numerous state licenses so I could help patients by using the video and phone technology. For people who don't know what telemedicine is, it's a method of communicating with a patient, either by video or phone. In some instances, by things like text messages and SMS and things like that. Although video and phone is usually the preferred modality for most state boards, medical boards.
Mm-hmm. So, what states are you licensed in?
Currently, I'm licensed in 35 states. So pretty much all the big ones, any state over 2 or 3 million population, and those 35 states cover about 90 to 95% of the American population.
Mm-hmm. And there is a list on our website, so people can actually go there and check out which states you are licensed in.
Yes. Likewise, I have a sorry.
That's okay. I was going to say, your website, what is the website address for that?
So for patients who are looking for to be evaluated for a low-dose naltrexone prescription, the web address is www.ldndirect.com. Okay.
Now, should any of those patients need blood tests to check out their thyroid or something, how does that happen when it's a telemed consultation?
Yes, so for the LDN Direct website, that's specifically just for patients who request a prescription for LDN. I also run an online virtual clinic called Root Causes Clinic, and that's for patients who need help beyond an LDN prescription. I tell patients that LDN and there are a lot of other therapies out there as well. Those are it's not a magic bullet therapy, meaning that it's very very uncommon for somebody to take just one therapy and expect it to make a huge difference. In the case of LDN, it can make a big difference, but a lot of times I use it in conjunction with other therapies. So for patients who are interested in a more holistic or integrated medicine approach, I created a virtual clinic called Root Causes Clinic, and that's rootcausesclinic.com.
Mm-hmm. Okay, so you talked about diet there. What diet do you recommend normally for people with, say, autoimmune diseases or cancer?
Well, I'm a big proponent of the paleo style diet. I think the theory of the paleo diet is sound. I think the foods that are recommended and recommended to avoid are also very sound, with modification. If somebody can tolerate dairy, then there's really no reason to necessarily restrict them from it.
Mm-hmm. And what about supplements and things? If you were to, obviously, you would tailor people's supplements to their condition and their needs. But if you had to say the top 4 supplements that you use, what would they be?
Well, usually before I recommend supplements, I put patients, me and my staff, patients through a rather lengthy intake form. It's about a 30-page form that kind of gets all the symptoms and all the history of a patient. And that kind of helps us guide the treatment for the individual. And to answer your questions earlier about the lab test, a lot of times if it's standard blood work, then we can, fax over or email over a lab requisition. You can go to your local hospital or local lab to get that done. If it's one of the specialty tests, like from Genova or Diagnostic Solution or SpectraCell, then usually we have the lab drop ship the patient a kit. And the kit includes instructions and everything that they need to get the test done. They send it back to the lab, and the lab sends us the results. And then obviously we schedule a follow-up consultation with the patient to go over the results and put together a plan. But in terms of the top supplements, I would have to say, I mean, there are so many. I'd have to say the top supplements would be, the basics: vitamin D, magnesium, coenzyme Q10, and let's see, what's the number fourth? I would say probiotics would be probably, but that would probably round up the top four.
Okay. So you've explained about the telemedicine, and you've explained about the root causes in blood tests where people could get the kits, etc. What happens if they need their blood pressure taken, for example? Mm-hmm. Would you send them to their regular doctor?
Yeah, well, I mean, typically when patients have come to us through the root causes clinic website or the LDN Direct, they've already seen several doctors. Oftentimes they've had blood tests and MRIs and colonoscopies and things like that. But if somebody's symptoms indicate that they need to be evaluated in person, then we tell them that, and we usually tell them to. We recommend that they go see their own family doctor, their general practitioner, to get evaluated, and then we try to coordinate with their in-person clinic to try to get those results.
Mm-hmm. Mm-hmm. So you would work together, basically.
Yeah, if that's what the patient wants, yes, absolutely.
Okay. And it's do they book their appointment with you online through your websites?
For the LDN Direct, yes, there is a booking link there for them, and that's a 15-minute consultation, like I said, to be evaluated for the LDN prescription. For the root causes clinic, they would book with one of my staff. I have a few functional medicine trained practitioners who work for me, and they do all the initial intake, and then they after the intake process and things like that are done, then my staff runs it by me. We discuss it. We figure out a plan, what lab test to order next, which supplements are appropriate. And the nice thing about being a medical doctor, to answer your question about the MD versus ND, is that we're allowed to use medications or prescribe medications such as LDN, whereas naturopaths in most states are limited.
Mm-hmm. And you said about Canada, Ontario, I believe, that you can prescribe. What about outside of the US? Are you allowed to do a telemedicine consult outside of the US and Canada?
Yeah, because I am licensed in Ontario, I am allowed to do telemedicine consultations for patients located in Ontario.
Mm-hmm. Yes, but outside of that, in other countries?
Not for a prescription to order blood work. The rules on that, as I understand them, is if you're in another country and I'm not licensed in that country, then I can provide what's called general advice or wellness advice, and there are a lot of practitioners out there who do that. That's kind of operating in a gray area, in my opinion, because it's very difficult to speak to a person and not treat them or diagnose them. And yet, if you're not licensed in that particular area where that patient's located, there is always that temptation to treat or diagnose. And as far as I understand from the laws, a medical doctor is not supposed to do that.
Mm-hmm. Okay, well, that's wonderful. Is there anything else you would like to add? nearly run out of time.
Well, with the Root Causes Clinic, we do offer a free 15-minute consultation, just so that patients can speak to one of the providers and see if that's something that they want to work with us on.
Okay, and they do that by contacting you by phone, not online.
No, it's they schedule the appointment online. So they go to rootcausesclinic.com and they would select one of the providers and schedule a free 15-minute consultation. The consultation would typically by phone.
Mm-hmm. So you've got two businesses going there, the LDN Direct and the Root Causes. Is there a waiting list? How long would people have to expect to wait to have a consultation?
Currently, for both of them, there's no waiting list. You would just have to find a time within your schedule that suits you. Mm-hmm. So for anybody, currently the way it is, I mean that could change in the future, but currently the way it is, there's no waiting list. Okay.
Well, thank you so much for being our guest today and explaining to us about telemedicine.
My pleasure. Thank you for having me.
Thank you.
And I'm really excited about all the work that your trust does, and I hope to be able to support it in any way that I can.
Thank you. This show is sponsored by Root Causes Clinic, who matches patients with an holistic wellness provider specialising in functional medicine to help them find and treat the root causes of their symptoms. Available in 35 states in the US and is 100% online. For your free 15-minute consultations with one of their practitioners today, visit rootcausesclinic.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.